The name of my presentation is Structural Equation Modeling of Male and Female Hand Washing Behaviors during the H1N1 pandemic influenza in 2009-2010. I will try to move you into a more behavioral focused research topic and less laboratory-centered research. So I would like you to open your eyes and understand this somewhat different approach, which is not related with the lab, okay, but with behavior, human behavior. And during my presentation, I'd like to share with you 7 points. First of all, we have to remember the time of this pandemic influenza. And I will use the word swine flu, like in the media, the journalists and the newspapers, the TV used that word at the time in 2009, 2010. And there were also some measures of disease control because there was a lot of confusion regarding vaccines and regarding treatments, whether one treatment functions or not, or whether the vaccine is efficient in coping with the threats of the swine flu. And then I will explain a theoretical model that we are using to understand the dynamics of the health behavior change approach when populations are facing a threat like the swine flu at that time. I also would like to explain 3 study hypotheses we have used to understand this dynamic, the method, the measures, some results, and these are specific structural equation modeling results, which I think you already are familiar with this kind of analysis, and final discussion. Okay, if you remember the 11th of June of 2009, the WHO declared that swine flu pandemic in phase 6. Do you remember that? Of course. It was a very surprising situation and also confusing. And 1 month after that, in July of 2009, more than 160 countries confirmed more than 170,000 cases of that swine flu. That was in a very short time. In our country and also in Central America and the Caribbean, there was no vaccine available to us, to our countries. We had no reliable way to cope with this threat. So in that situation, education and hand hygiene, which is a health behavior, and the use of protective masks and the recognition of risk factors, which is a risk perception construct, and symptoms identification, which is knowledge, were, among other measures, fundamental in coping with the threats of swine flu and seasonal influenza, not only in Latin America, but also in Europe. For example, Germany rejected the vaccine after one German soldier was dead after the vaccination, and they have rejected the vaccination, massive vaccinations in Germany, not only in. So this situation was quite confusing. And in our case, that we are a developing country, so we invested a lot of efforts in prevention. And we can do that in a small country, but not in a big one like the U.S. or Germany or China. But in small countries, there is quite possible to educate people when we are only 4 million or 4.5 million persons. And if you remember the protocol of the WHO, do you remember that? Every one of you have heard about this protocol. Then there were two two waves of educating people on how to hand wrap with an alcohol-based formulation that was in about, let's say, 20 seconds or 30 seconds. And the other option for the population was to learn on how to hand wash with the soap and water solution. And but the question to us was what motivated Costa Ricans and Latinos population who lives in the U.S. or Latin Americans living in Latin America in developing countries to adopt such a protocol. Okay, we already understand the protocol, but what motivates people to adopt the protocol when there is no vaccine to prevent the infection? Those kind of questions are interesting to us in the field of behavioral medicine. Specifically, we were interested in answering what motivated people for hand washing their hands after having contact with others, like we are doing today. How many of you have washed your hands today? How many times? Good, congratulations. And the other question was what motivated people in hand washing behaviors after having used the bathroom. I want to ask how many of you did this. And also hand washing behaviors before eating. This is very important. Before eating, after use the bathroom, after having contact with others, even after having touched objects contaminated by sick persons or persons who might be sick. We may never know. And this is some kind of conceptual model to understand the dynamics of how a person in facing a pandemic influenza moves from the perception of the situation into the intention of adopting the behavior and then finally adopting and maintaining the preventive, the precautionary measures, in this case, washing their hands, either with a hand wrap strategy with alcohol or just simple water and soap, yeah? and singing happy birthday to you. And when you end that, you're ready in 40 seconds, 60 seconds. So what motivates people in doing that, in facing the swine flu pandemic? So we investigate that by using or by proposing three types of hypotheses. A general hypothesis, in this case, we expected that the perceived risk of getting swine flu and also common influenza at that time, this was in 2009, and the hand washing self-efficacy, the personal perceived self-efficacy for hand washing behaviors in 4 different contexts would increase the hand washing intentions. I mean the intentions of going to the bathroom or using the hand wrap solution, the alcohol-based solution, and consequently moving into the behavior step and adopting and maintaining the behavior as such during the 2 waves, 2009 and 2010. The second hypothesis is a more gender and cultural related hypothesis, because Latinos who lives in Latin America are in their behaviors, the health protective behaviors are somewhat different, and it has to do with gender differences and also cultural differences. We don't have studies for Latinos in the United States to understand this. This is particular characteristics, but it might be also interesting whether we can replicate this studies not only in Germany, but also in Latin America, in the US, with Latinos population. There are a lot of Latinos here. I have speak Spanish many times during these 2 days. There are Latinos everywhere here. And investigating cultural and gender differences in the adoption and maintenance of protective measures of the WHO might be of interest also for you. And the third hypothesis has to do with the long-term effect, expectations in terms of that we expected that there might be a long-term influence of what you did during the first wave onto the second one. Specifically, we expected that perceived risk of getting that swine flu, and also common influenza, and hand-washing self-efficacy, and hand-washing intentions during the first wave of the pandemic that was in 2009 would account for a good amount of variance of hand-washing behaviors during the second wave. That would be about 8 months after or 7 months after the first peak. To evaluate those hypotheses, we investigated a random sample of Costa Ricans of about 450 adults, and the final sample was about 428 adults, 65 females, about 35% of them males. The mean age was about 33 years. And at time 2, during the second wave, we investigated a subsample of the first sample. So we have assessed the same people at 2 measurement points in time and applied the same instruments. This is a longitudinal design that you already know how it works, but we use a structural equation modeling approach by using the multi-group approach and longitudinal approaches. All right, let's move into the results. This is a structural equation modeling, the path diagram of the female group and the causal relationships, and I'm using the word causal because LISREL allows to evaluate causal relationships and not associations, but causal relationships. And what is interesting here, in the case of the females, that there is no direct effect from taking origin from the risk into the behaviors. There is also no significant effect going from self-efficacy beliefs, going to the behaviors, the adoption and the maintenance of the WHO protocol. But in the case of the females, and we are still investigating why is this happening, this is a perfect mediated model. So the influence of the risk perception and the self-efficacy for hand-washing behaviors influences the adoption and the maintenance of the WHO protocol only by the mediation of the intentions. And this pattern of relationships are significantly different from the male group. And this is the most important, the most interesting result of our study. Because if you take a look at the males' relationships, the male is somewhat different. In what sense? We have only here significant effects going from self-efficacy into the intentions of adopting the WHO protocol, and there is a direct effect going from self-efficacy beliefs to the behavior, so the adoption and the maintenance of the protocol during the peak, the first peak. So this is suggesting that the males completely ignored the risk of infection in the Latinos. Okay, the male Latinos ignore the risk. Why is that? That's the question. Are we some kind of machos that we think that we are invulnerable of getting sick, or perhaps we believe we are stronger as compared to females, or more guapos? Well, we have to investigate this, and it is really quite important to understand why a typical Latino who is living in Latin America, completely ignore the recommendations of the public health authorities and the WHO, and they rather focus on the self-efficacy of adopting the protocol. And if you look at the female model, there is a structural difference in the causal relationships. How did we calculate this structural difference? Well, you can do this with the software by running the multi-group option with literature. I'm sure that you already familiar with this kind of analysis. And you just simply run the two samples. You run the two samples at the same time and calculate based on covariance or correlation matrix, which is the input for the software. And then the software calculates the causal relationships. And in doing this, you get some fit calculations, adjustment, and to evaluate whether the gamma matrix, which is a metric of causal relationships, are significant different from each other. I mean, the male matrix versus the female matrix. This is in mathematics calculations that the software calculates in a couple of seconds. Well, the last model, in sum, at the moment we have only a comprehensive model, which we would like to analyze in comparisons with different cultures to examine whether the causal structural matrix is invariant or not, whether there are invariants in causal relationships across the cultures and across gender and across different variables such age and education and etc. But at the moment, we like to concentrate on gender differences and cultural differences. This is the comprehensive model, and it's easy to understand the differences between males and females. Intentions in both cases play an important, very leading role in the adoption of the protocol of the WHO for hand washing and behaviors. And the unique difference, we found that the risk is important for the females, but not for the males. We completely ignored the risk. And then the question is, why is that? Why Latinos do that? And this is an obstacle, a barrier in order to educate these populations, these groups. It doesn't matter whether this group lives in America or oh, I have 0 minutes left. Thank you. Well, in concluding my presentation, let me share with you the last model, Lisser model, structural equation modeling. We wanted to investigate the role of the time. And the question was, across the time, what happens with the influence of social cognitive predictors? Is there an influence from time 1 to time 2, and which construct or which variable is the strongest in predicting the future behavior? So, and we found something interesting, that the same predictor predicts itself across the time in the best way. This means that if you wash your hands today and you do a good job by adopting and maintaining the WHO protocol during the pandemic, you will for sure do this again in the next wave and in the next peak. So, and why are we then investigating sociocognitive motivators and variables? Well, we are doing this because those variables are very important during the first time. They were very important in the first wave. And then people moved into developing the intentions and adopting the hand-washing behaviors. And hand-washing behaviors explain it from time one, explain hand-washing behaviors at time two. And now significant relations were found between predictors of time one with the time two. Okay, I conclude now. I conclude now, and
They were your idea.
oh, it was like a sin can. Okay.
Any questions?
Questions? Okay, thank you a lot. Yes, please.
From knowing your culture, is it possible that in general hand washing affects the macho impression of an individual?
Yes, I think this is a very important question, and we think that we are investing a lot of money in our country in giving the wrong message to those groups. I think that a good wash hands are attractive for the females. In our culture, if you have nice hands, that would be nice for the female's perception of your macho image. And that would be, I think, a way to educate males, at least in our country, in recognizing the importance of adopting the WHO protocol. But we haven't found a formula to convince the Ministry of Health in doing this. But we are negotiating.
Any other?
There's another possibility besides perception of being invulnerable. Could also be a fatalistic view that, I accept my fate, whatever happens to me, and maybe men in the culture maybe are more of that mindset. If I get sick, there's nothing I can do about it.
Well,
tomorrow. Be such a positive involvement.
Yeah. In terms of modeling behaviors, there are many chances of predicting behaviors. We can introduce new constructs here as religion, for example. In some cultures, in the Latino culture, religion is quite related to the adoption and the maintenance of health behavior. For example, the Mexicans pray to the Virgin of Los Angeles to give them a good health. And this is a barrier in the adoption and maintenance of protective behaviors, such as vaccinations, or just simply washing your hands. So there are many variables that we are still investigating, like the one you said. We can, but we have an open architecture model that we can replace some variables for another, and understanding what would be the effects on a long-term basis. Is that clear to you? Okay.
I have a question back here.
Okay, please.
It's a two-part question. One, where was this study done? Was it in a hospital setting or a community center? In terms of watching them?
You mean data collection?
Yes.
Data collection. Well, this research is part of a broad investigation that started in Constance in Germany at the time of the pandemic influenza. That was in 2009, and then the Germans, after the death of this military, they started by investigating alternative strategies of protecting the population, like hand-washing behaviors. And the original sample was of about 9,000 Germans who lived in Constance and Berlin and everywhere of the German lands. And then at that time I was conducting my postdoctoral studies in Constance, And then Professor Brenner told me whether we were interested in replicating the study in Latin America because we were the second country in having the diagnostic after Mexico of the swine flu. And that's why the reason we replicated the study. And we tried to randomize the sample by including the broad characteristics, even people with low levels and high levels of education, a broad range of characteristics. The second
question, just because I'm more hospital-based, any isolation parameters implemented as well in terms of masks or anything like that in terms of prevention?
Well, the question has to do with many aspects that we can adopt in Latin America for prevention in the absence of a vaccine. For example, the use of mask. This was an extended measure for the health-related workers at the hospitals and the clinics. And we are lucky because we are a small country, so we can concentrate resources and several populations. And this is not easy to do in a country like Brazil, for example. There's a lot of Brazilians, and you have to invest millions of dollars in preventive actions, like in the U.S. And this is interesting. So if you have a small country, you can evaluate a prototype of prevention and then to evaluate this prototype in a more broader sample. I don't know if this answered your question.
Yeah, it is.
Okay.
Good stuff. All right, very quickly.
Is there any learning effect because the second sample coming from first one?
Yeah, the second sample is a subsample, and there are many ways of analyzing this kind of data. You can conduct bootstrapping strategies and let the computer to make 100,000 subsamples, but we have rather decided to make the subsample by using the formula paper and pencil solution and avoiding to letting the computer to randomize the sample. Did that answer your question? Okay, so if you explain it to me, I'll then. Sorry? Okay.
Saying have a chat at lunch.
Oh, okay, at lunch we can. Okay, thank you very much for your attention, and
Very good. Thank you.
then we can.